morning all, we are discussing regarding chronic periodontitis. We all know that chronic periodontitis is the most commonly frequently seen periodontitis as compared to that of the aggressive periodontitis, and it usually occurs among the adult patients or frequently seen in adults whose age is greater than 35 years. Can also occur in case of children and in adolescents in response to that of the plaque and the calculus formation. And so, regarding the clinical features, the most common feature of chronic periodontitis is there will be gingival inflammation, followed by periodontal pocket formation. Then there is loss of attachment and loss of alveolar bone. So, regarding the clinical changes, we all know that in case of gingivitis, there will be first sign we can see is bleeding on probing. This same can be replicated in case of chronic periodontitis, and there will be also slight to moderate gingival enlargement and rolled gingival margins and flattened or freighted papillar LTC. And later on, there will be bleeding on probing, which can progress to that of the production of the exudate, thickened fibrotic gingival margins, variable pocket depth, and also in some cases there will be recession will be also present. Mainly seen in cases of lower anteriors. Usually we all know that the plaque deposition will be more commonly seen in cases of lower anteriors and in cases of buccal aspect of the maxillary posteriors. And later on there can be furcation involvement, tooth mobility in cases of advanced stages. Occasionally there can be periodontal abscesses, and in radiographically there will be both horizontal and vertical bone loss may be observed. In this radiograph, we all know that there is a horizontal bone loss. The bone loss extends up to middle 1/3 of the tooth, and some tooth shows periodontal abscesses. And this chronic periodontitis is classified based upon the distribution as localized and generalized. Localized means that when the size involved, or if it is the size involved is less than 30% of the total tooth, then it is called as localized. When greater than 30% of the sites are assessed in the mouth, demonstrate attachment loss and bone loss, then it is considered as generalized periodontitis. Then based upon the severity, this chronic periodontitis is again divided into 3 types: mild periodontitis, moderate periodontitis, and severe periodontitis. So mild periodontitis, also called as slight periodontitis, here the attachment loss will be about 1 to 2 mm. There will be minimal furcation involvement and tooth mobility, bleeding on probing, and minimal radiographic contours. And in case of moderate periodontitis, attachment loss will be about 3 to 4 mm, and there will be early to moderate furcation involvement, slight to moderate tooth mobility, bleeding on probing, and purulent exudate will be seen, and radiographically the bone loss will be up to 40%. In case of severe periodontitis, the clinical attachment loss will be greater than 5 mm, and there will be grade 2 or grade 3 furcation involvement will be present, and excessive tooth mobility will be seen, and more than or greater than 40% of the bone loss can be observed radiographically, along with that of the angular bone difference. And patients usually complain of frequent bleeding and pus discharge. So that's all regarding the classification of periodontitis. We all know that according to distribution, we have already told that in case of distribution it is classified as localized and generalized, and in cases of based upon the severity it can be classified as mild, moderate, and severe. Then coming to that of the symptoms, how the patient feels in cases of periodontitis. Usually it is a painless condition, and sometimes there can be a localized dull pain radiating deep into the jaws, and can be sensitivity may be present due to the exposure of roots in cases of recession, and patients may complain of foot impaction, gingival tenderness, and itching and sensation. And disease progression, the rate of progression is different in different people and also among the different regions of the tongue. And some involved areas may remain static for a long period of time, and sometimes it can cause a random burst. And usually it may progress rapidly in areas such as percussion in the proximal area, areas of overhanging restoration, food impaction and malposition teeth. In these areas, the cleaning or accessibility for cleaning will be difficult, and it can result in more amount of plaque accumulation in that area and can result in rapid progression of the periodontal disease. And various models have been proposed for the progression of the periodontal disease. First model is continuous model. Here it states that the periodontal progression is in a continuous manner. Then second one is random or episodic burst model. That means the chronic periodontitis bursts in a random fashion. And last one is asynchronous multiple burst model. Then coming to the risk factors for chronic periodontitis. The main first risk factor is there can be a prior history of periodontitis. And the local factors are plaque accumulation, there can result in increased amount of gram-negative anaerobic bacteria in the subgingival plaque and can result in chronic periodontitis. So usually in case of gingivitis, there will be gram-positive bacteria, but as it progresses to periodontitis, there will be accumulation of subgingival plaque and can also result in subgingival plaque and also result in more amount of gram-negative microorganisms and can result in periodontitis. And the most commonly seen bacteria in case of periodontitis is red complex, that is it. Porphyromonas gingivalis, Standardella forsythia, Treponema denticola. And plaque retentive factors are calculus, overhanging restorations, percussion, malaligned teeth, subgingival caries, root grooves and concavities. And other factors are occlusal trauma, systemic factors like diabetes, osteoporosis, and environmental behavioral factors like smoking and psychological stress, and genetic factors which includes interleukin-1 polymorphism. So these all are the risk factors for diabetes mellitus. So then coming to the, as a whole, diabetes mellitus, risk factor for chronic periodontitis as a whole. Chronic periodontitis is an inflammation in cases of gingiva and it can progress to that of the periodontal ligament and can result in periodontitis and the various clinical features. Then regarding the different classification and also regarding the how progression of the periodontitis, and lastly come into the treatment aspects of this periodontitis. First of all, in case of chronic periodontitis, we have to do scaling and root canal. Then we have to recall the patient, and if the pocket is still persists, we can do flap surgery, or we can do pocket elimination procedures, and also can administer local antibiotic therapy. And we have to recall the patient. And the main thing regarding the chronic periodontitis is that frequent recall or frequent maintenance is a must. So that's all regarding chronic periodontitis. I think it's clear. Next class we can move regarding the we can discuss regarding the radiographic features in case of chronic periodontitis. So like that. In cases of chronic periodontitis and aggressive periodontitis, how it can be differentiated is, first one is, in case of chronic periodontitis, there will be more amount of plaque accumulation compared to that of the aggressive periodontitis. And second thing, there will be vertical bone loss will be present in case of aggressive periodontitis, but in case of chronic periodontitis, there will be horizontal bone loss. So these are the things which can be differentiated between chronic and aggressive, and usually aggressive occurs in age below than 35 years, and compared to the case of chronic usually occurs age above 35. So that's all. Thank you.